This March, what we all associated with life as normal changed dramatically. As we are learning how to navigate life with COVID and keep our families safe, we must remain vigilant about our overall health. It is extremely important to keep up with routine preventative health maintenance, such as annual physical exams, blood pressure assessment, weight management, along with screening for cholesterol and diabetes. Women over the age of 40 at average risk for breast cancer should have mammograms performed annually. Men and women over the age of 45 at average risk for colon cancer should consult with their physician about a screening colonoscopy. Remember, vaccination for flu is highly recommended for almost everyone 6 months or older. Older adults should discuss vaccination for shingles and pneumonia based on their age and risk factors with their providers as well. If you have children, make sure they too are up to date on their routine exams and immunizations, particularly as schools reopen. Hospitals and physician offices have implemented a number of safety measures to ensure that in-person visits are safe. Additionally, most healthcare organizations have a variety of ways for you to access care, which include in-person and virtual visits. While we must continue to practice the recommended safety measures to prevent the spread of COVID, such as facial coverings, social distancing, and hand washing, we must also work to prevent common illnesses and be alert to the signs and symptoms of other serious conditions like heart attack and stroke. We should discuss worsening anxiety and depression symptoms with our providers. So this is an excellent time for you to focus on your overall wellness to help cope with changes and added stress and anxiety associated with its time. Remember, heart disease is still the leading cause of death in the United States. With that in mind, commit to incorporating regular exercise into your daily or weekly routine. With the milder weather, carve out some time for a walk or a bike ride, alone or with your family. Diets rich in fresh vegetables, fruits, nuts, whole grains, and lean meats have all been proven to improve mood and a person's sense of well-being. Find ways to cook healthy meals at home that can involve the entire family. Continue to come up with creative ways to connect with friends and relatives. If you have time, identify ways to help people in your neighborhood, your school, or your job that may need additional assistance during this difficult time. All of these things may help improve your overall health and/or sense of well-being. Lastly, if you or someone you know is struggling with mental illness, there are a number of resources to help. Locally, we have stigma-free Fishers, or you can dial 211 for help. The State Department of Health has resources for mental health on their website as well. Lastly, there is the National Suicide Prevention Lifeline at 800-273-8255, and the Mental Health Coalition, which includes resources for the LGBTQ community and people of color who might be struggling with depression or anxiety. I'm an extremely proud resident of the City of Fishers. We have to continue to work together and consider not only our own individual health and wellness, but the health, wellness, and safety of all Fishers residents and the surrounding communities. Together, we can keep businesses, schools, and our community open and safe. Thank you so much.